Every day, our body is exposed to thousands of microorganisms. Most of these microorganisms actually live peacefully with us. They are part of our normal microbiome and they may even be beneficial. However, some of them have the ability to invade our tissue, multiply, and ultimately cause disease. Now, understanding how these microorganisms interact with the human body is the foundation of infectious disease pathology. Hello, everyone. My name is Baylasan Ayman, and I'm from Year 1. And today I'm going to be going over the general pathology of infectious diseases. In this video, we're going to look at the major types of infectious agents, how they enter and spread within the body, and what mechanisms do they use to cause damage, the diagnostic tools that we can use to identify infectious agents and what infections they cause, and how pathogens cause disease, which is pathogenesis. With that being said, let's start with the first part of today's video, which is the infectious agents. Now, infectious agents can vary widely in their size, complexity, the mechanisms that they use to cause disease, the diseases that they cause. So the main groups that we're going to be looking at today of infectious agents are prions, viruses, bacteria, fungi, protozoa, and helminths. And in this order, they are ordered from smallest to largest. And there's a mnemonic that you could use to remember this order, which is please vaccinate before funeral procession happens, or pathologists very busy finding parasite hosts. Now, let's start by taking a closer look at the first infectious agent, which is prions. Prions are basically misfolded proteins that can cause disease. They are not cells, they are not genetic material, they are just misfolded proteins that can cause disease. To better understand prions and how they cause disease, let's take an example. So normally our neurons have a protein called PRPC. This is a normal protein found on our neural cells. However, sometimes this protein can become misfolded, and when it does, it leads to the formation of an abnormal misfolded protein called PRPSC. Now, this misfolded protein has two key properties. The first property is that it's resistant to proteases. And we know that proteases are enzymes that normally break down proteins. So, because it's resistant to them, this protein cannot be broken down. So, if it cannot be broken down, it begins to accumulate in the brain. The second property is that this abnormal protein can convert normal proteins into abnormal ones. So, in other words, if you have a PRPSC, which is the abnormal protein, if it comes in contact with the normal protein, it can force it to change shape and become abnormal as well. Now, as more and more of the misfolded proteins accumulate in the brain, they can start to cause several diseases and pathological changes. So that leads us to what happens when the abnormal protein accumulation happens. So what does this accumulation lead to? It leads to three things: neural loss, gliosis, and spongiform change. Obviously, we'll have neural loss, meaning that the neurons begin to die, and this neural loss actually leads to gliosis. Gliosis is a somewhat similar process to fibrosis, but it occurs in the brain. So, because the neurons die, the brain starts to replace them with glial cells. And we know that glial cells are the support cells in the brain. Now, these glial cells start to act somewhat as like scar tissue in the brain. So when the neurons die, the glial cells multiply and they proliferate to fill in the damaged areas. Now, the last characteristic that we can see is spongiform change. The word spongiform just basically means that the brain starts to look like a sponge under the microscope. So we start to see a bunch of tiny holes in the brain. Now, an important point to remember is that there is no inflammation caused in prion diseases. We do not see any inflammation. Speaking of diseases, what are the diseases that prions cause? The diseases caused by prions are grouped, or they belong to a group called transmissible spongiform encephalopathies. And from its name, we can understand a lot about it. Transmissible means it can be spread. Spongiform, as we said, tiny holes in the brain. And then encephalopathies, brain diseases, or brain pathologies. Now, we're going to take 3 disease examples, and those are Creutzfeldt-Jakob disease, or CJD. Another example is Kuro disease, and Kuro disease was actually discovered in New Guinea, Papua New Guinea cannibals. And if you don't know what cannibalism is, it basically just means the ingestion, the taking in human tissue, so eating human tissue. So what happened is the people of this tribe started to eat human tissues, and they ended up eating a brain that was infected with prions. And they developed uncontrolled dancing-like movements. Now, the reason they developed uncontrolled dancing-like movements is because the cerebellum was damaged. And we know that the cerebellum is the part of the brain that's responsible for coordination. So if you damage that part, it makes sense that we would see abnormal dancing movements. Another prion disease is bovine spongiform encephalopathy, BSE, and it's commonly known as the mad cow disease. This disease appeared in the cattle industry when cows were fed infected meat and bone meals. They developed this disease. Now, it's important to note that humans that ate the infected cows developed a condition of variant CJD, so variant Creutzfeldt-Jakob disease. Another critical kind of point or idea about prions is that they are heat resistant. They are resistant to heat. This means that normal sterilization procedure may not be able to destroy them. They might be harder to destroy. Moving on, to kind of summarize prions, you can actually use their name as a mnemonic. So prions, P, protein only, R, resistant to proteases, I, induce misfolding of other proteins, O for no inflammation, and N for neurodegeneration because they cause neurodegenerative diseases. Now that we're done with prions, let's have a look at viruses. Viruses are obligate intracellular parasites, and this means that viruses cannot live or reproduce on their own. Instead, they must enter a host cell and use the cell's machinery in order to replicate. Let's have a look at the basic structure of a virus. Now, viruses have 2 main components, and those are the genome and the capsid. The first component, which is the genome, is just basically the genetic material of the virus. And the virus can have either DNA or RNA as its genetic material, but it can never have both. So either DNA or RNA, never both. Now, for the second component, which is the capsid is like a protein coat or a protein shell that surrounds the genome, and it protects the viral genetic material and it helps attach it to host cells. Now, when the genome and the capsid are combined together, they form what is called the nucleocapsid. Some viruses have an additional structure called the envelope. Now, the envelope is an outer lipid membrane that surrounds the virus, and this envelope is actually acquired from the host cell membrane, which means it's not always a permanent part of the virus. Some viruses can take this membrane from the host cell and produce their outer lipid membrane. And if we look here at the image on the right, you can see we have the nucleic acid, so the genome, surrounded by the capsid, which form the nucleocapsid, and then the nucleocapsid is surrounded by the envelope. Now, the presence of the envelope is actually very important because enveloped viruses are usually more fragile and are easily destroyed by soap and detergents, whereas the non-enveloped viruses are generally more resistant. And as we said, viruses acquire the envelope from the host cell. Another important kind of property or concept in viruses is latency. What is latency? Latency basically means that the virus can remain silent or dormant inside the cell. And during this period, the virus remains inside the cell. It does not actively replicate, but it can reactivate later and begin to replicate again. Examples of viruses that show latency is HSV, VCV, and HIV. Now let's have a look at the types of viruses. We can divide viruses based on their genome into three groups, into DNA viruses, RNA viruses, and retroviruses. Before we talk about the details of these viruses and what's so different about them, let's just have a basic understanding of a concept that all viruses must produce mRNA. And why do they all need to produce mRNA? Because host ribosomes can only translate mRNA into proteins. mRNA is the only code that ribosomes can read to produce proteins. So all of these viruses must find a way to generate mRNA in order to produce their viral proteins. So obviously different viruses will have different strategies to achieve this. So let's have a closer look at each of these viruses and the strategies that they use to produce mRNA. Starting with DNA viruses. Obviously from their name, DNA viruses have DNA as their genome. The strategy that they use to replicate actually involves using the host cell polymerases to produce mRNA. In other words, the host cell nucleus transcribes the viral DNA into mRNA, which is then used to produce proteins. So if we were to think of the steps of what happens, the virus enters the cell, the viral DNA enters the nucleus, the host enzyme, usually RNA polymerase II, produces mRNA, the mRNA moves to the ribosome, and then the viral proteins are produced. An important feature of many DNA viruses is that they can actually integrate into the host's DNA and become latent. Examples of DNA viruses include herpes simplex virus and varicella zoster's virus. Next, let's have a look at RNA viruses. Obviously, again, from their name, they have RNA as their genome. These viruses must encode their own enzymes to produce RNA. And the reason for this is that human cells cannot copy RNA to RNA. So why is it that RNA viruses need to encode their own enzymes to produce mRNA? Why do they need their own enzyme? Because human cells cannot copy RNA into RNA. And what I mean by that, usually the human cells go from DNA to RNA, from RNA to protein. However, they cannot go from RNA to mRNA replication. We can't do that. So the RNA virus must bring its own enzyme called RNA-dependent RNA polymerase. And this enzyme allows them to convert RNA into mRNA, which is then translated into viral proteins. Examples of RNA viruses is measles and mumps. Lastly, let's have a look at retroviruses. Retroviruses are a special type of RNA virus. What makes them so special is that they contain an enzyme called reverse transcriptase. Now, what does reverse transcriptase do? To understand what reverse transcriptase does, let's review what we said normally happens. So the normal process is DNA to RNA to protein. However, retroviruses reverse this process with the help of reverse transcriptase, and they convert RNA to DNA. So basically, the replication process basically is as follows. The virus enters the cell, and then reverse transcriptase converts RNA into DNA, and then the viral DNA integrates into the host's genome, so it becomes part of the host's genome, and then the host nucleus produces the viral mRNA, and then the viral proteins are made. Once the viral DNA integrates into the host's genome, it becomes part of the host's DNA. So this means that every time the host cell replicates, the viral DNA is also replicated with it. All right, examples of viruses that do that are HIV and HTLV. Now, just a side note, which we're going to revisit later, but I thought it would be nice to include it now since there was a question asked about this in lecture. So just a side note, viruses produce characteristic microscopic changes. So we can see under the microscope changes to the cell caused by the virus. Let's take an example, herpes virus, for example. They cause what we call the 3 M's of herpes virus, which is 3 classical changes that we can see in herpes virus. And those are multinucleation, migration of chromatin, and nuclear molding. In multinucleation, the infected cells fuse together and they form a large cell with multiple nuclei. In the migration of chromatin, the chromatin gets pushed to the edge of the nucleus, making the center appear clear and empty. The third change is nuclear molding. So when the many nuclei are packed into one cell, they press against each other. And because of this pressure, the nuclei become distorted and take the shape of adjacent bacteria. We're going to actually revisit this again at the end of this video where we talk about again, the viral cytopathic changes that we can see, but I thought I would explain this in a little bit more detail so that it's easier to answer any questions about the herpes virus 3Ms. Now that we're done with viruses, let's have a look at bacteria. Bacteria are prokaryotic microorganisms that can cause infections in humans. Just a quick review of the difference between prokaryotic and eukaryotic microorganisms. The most important difference is that the DNA for bacteria is found in the cytoplasm, whereas in eukaryotes it's contained in the nucleus. Now, another important point about bacteria is that bacteria can synthesize their own DNA, RNA, and proteins. So they are basically independent living organisms. So why do they infect host cells? What do they need from them? The host cells provide a favorable environment, so better temperature, better nutrients, etc. And so that's why they infect them. Now, let's look at some of the typical tissue responses that our tissue exhibits when it's infected by bacteria. And we will also revisit this point in a little bit more detail when we talk about damage caused by infectious agents. But I thought I would discuss this a little bit here, specifically for the damage caused by bacteria. So when bacteria infect tissues, the typical tissue response is called a suppurative inflammation. So the suppurative inflammation also is sometimes accompanied by pus formation. And pus is basically just a thick fluid that is composed of several components, including liquefactive narcotic tissue, narcotic dead neutrophils, which are also called pus cells, bacteria, cellular debris, and inflammatory enzymes. Now, you might wonder why liquefactive necrosis happens, and it basically just happens because the neutrophils release enzymes that digest the infected tissue, and then these enzymes break down the tissue structure. They cause liquefaction, which essentially just means that the tissue begins to melt, and so as a result, the infected area becomes stuffed and filled with pus. It's very important to remember that it's liquefactive narcotic tissue. Now that we're done with bacteria, let's have a look at fungi. Fungi are eukaryotic microorganisms, and we're going to be looking at two main morphological forms of fungi today, and those are or two main structural forms, and those are yeasts and molds. Some fungi are capable of switching between the two forms, and we call them dimorphic fungi. But today we're just going to focus on the yeasts and molds. Yeasts are single-celled fungi, and they appear round or oval under the microscope. They reproduce by budding, and just to review what budding is, it's basically just when a small outgrowth forms, as we can see here, on the parent cell, and the bud continues to grow until eventually it separates and becomes a new yeast cell. Examples that we have of this are Candida and Cryptococcus. Moving on to molds. Molds are multicellular fungi, and they grow as long branching filaments, and we call these filaments hyphae, and a network of these hyphae is called a mycelium. Now, it's important to note that fungi are a little bit difficult to visualize using regular stains. So pathologists frequently use special staining techniques to be able to see fungi, and those are GMS stain and the PAS stain. For the GMS stain, we see the fungi appear black against the green background, and for the PAS stain, the fungi appear to be bright magenta or pink under the microscope. Let's have a look at the types of fungal infections. So fungal infections are usually classified on like how deep they invade into the body, into superficial infections and deep infections. Superficial infections occur on body surfaces, so skin, hair, nails, etc. An example would be dermatophytes. So dermatophytes infect keratinized tissue, and they cause diseases known as tinea infections. Now, we can also have chronic infections, which are also called mycetoma, myce for fungi, toma for growth or mass. So mycetoma is a chronic fungal infection that forms mass-like lesions. Now, these infections usually progress slowly over a couple years, a couple months or a couple years, so that's why they're called chronic, obviously. Now looking at deep fungal infections, they usually occur in immunocompromised patients, so patients with HIV, undergoing chemotherapy, organ transplantation, etc. Now, in immunocompromised patients, the fungi can spread through the bloodstream, invade the tissue, and damage organs, and this leads to a systemic fungal infection. However, in healthy, so immunocompetent patients, the infection either resolves completely or it becomes latent. Next, we're going to look at protozoa. So protozoa are single-celled eukaryotic parasites. One important feature is that they can replicate in the human body, and this is the main difference between them and helminths, which we'll discuss later. Protozoa can replicate in the human body, and because they can do that, the protozoa infections can worsen rapidly. So where do protozoa live in the body? When they infect our body, where do they go? They either live intracellularly or extracellularly. Now, intracellular protozoa invade the host cells and they reproduce inside of them. Examples of cells that they infect: RBCs, macrophages, skeletal muscles, myocardium, brain, eyes, etc. Examples: we have malaria. Malaria parasite actually infects the red blood cells. In fact, if we find protozoa inside RBCs, this is a hallmark finding in malaria diagnosis. Another example is toxoplasma. Now, moving on to extracellular parasites, some protozoa, live outside the cell, so in the intestine, in the urogenital tract, in the blood. Lastly, let's have a look at helminths. Helminths are actually parasitic worms, and unlike protozoa. Helminths are multicellular, they are large organisms, and in many cases they are visible to the naked eye. We can actually see them. Now, it's important to kind of give a note here that infections caused by helminths are actually called infestations. So we refer to the worm infection as infestation, not as infections. And we also use this term for ectoparasites, which we'll discuss in a little bit as well. A very important concept is that adult helminths do not multiply inside the human body. Instead, they live within the host, they produce eggs or larvae, and then these eggs or larvae exit the body, usually through stool. And that's why when we want to diagnose helminths diseases, we look at a stool sample and we're looking for eggs or larvae. Humans can carry different stages of worms, and those stages include adult worms, immature worms, or larval stages. And we call the form that enters the body as the infective stage. So the form of the helminth that enters the body is called the infective stage, and usually it's eggs or larvae. There are three major groups of helminths, and those are roundworms, also called nematodes, tapeworms, also called cystodes, and flukes, also called termitodes. Now, let's have a look at ectoparasites. From the name, we can learn a lot about them. You know, ectoparasites, ecto outside, parasites living at the expense of a host. So, ectoparasites are parasites that live on the outside of the body, and they cause problems mainly by biting the skin, or they live on or within the skin, and they trigger itching and inflammation. There are two types of ectoparasites: insects, which include, lice, bedbugs, fleas, etc. And the second group is arachnids, which include mites and ticks. Now, as we said, we call infections by ectoparasites as infestations. So, infestation of the skin by arthropods leads to excoriations, and excoriations just basically means skin scratches or abrasions that are caused by excessive scratching due to itching. We have two examples of infestations caused by ectoparasites or arthropods, and those are pediculosis and scabies. Pediculosis is the infestation of the hair by lice, in which the lice attaches to the hair shaft and the scalp. The second example is scabies, which is caused by the mite Sarcoptes scabii, and these mites burrow into the stratum corneum of the skin. Another important concept is that arthropods can actually act as disease vectors. So they can transmit diseases from a host to another host. So what do we mean by a vector? A vector is just basically an organism that transmits pathogens from one host to another. The vector itself does not cause the disease directly, but it carries the disease and spreads it to another person. An example of this is deer ticks. Deer ticks actually transmit the bacterium Borrelia burgdorferi, which causes Lyme disease. Now that we know all about the infectious agents, how can we diagnose them? What are the tools that we can use to diagnose these infections or to detect these infectious agents? We have a couple methods. The first one is a PCR, and the PCR detects the pathogen DNA or RNA. We can culture, so we look at the live microorganism, and this helps us identify the organism and the antibiotic sensitivity. We can look at the histopathology, so we can look at the tissue damage pattern, which we'll also discuss later on in this video. We can know what infectious agents caused this disease by what damage they created to the tissue. And lastly, we have serology, which is looking at the antibodies, so looking at IgM, IgG, and this just looks at the immune response. So if we understand what immune response is happening, we can narrow down the disease that triggered this immune response. Now let's talk about the second main concept that we're going to be discussing today, which is microbial pathogenesis. So now that we've discussed the different types of infections, let's have a look at how these infections, or the mechanism that these infections use to cause disease. So microbial pathogenesis basically refers to how microorganisms cause disease inside the human body. And to properly understand microbial pathogenesis, they're divided into four major steps, and we can summarize them using the mnemonic EDDE, so EDDE. Those four steps are entry, then dissemination, then damage, then exit. We're going to have a look at each of these four steps in detail, but you can use this kind of roadmap as a summary to remember the four steps that infectious agents use. So let's start with the first thing, which is entry into the host. Now, there are many routes that infectious agents can use to enter the skin, to enter the host. The first one is through the skin. So they can enter the host through the skin. The skin is actually one of the strongest protective barriers in the human body, and under normal circumstances, the skin blocks microorganisms completely and prevents them from entering deeper tissues. However, pathogens can still enter the body through the skin in two main ways, either through direct penetration or through damaged skin. Now, looking at direct penetration, some organisms are capable of penetrating even intact skin. Examples are dermatophytes, fleas, ticks, mosquitoes, and these organisms can enter the body in several ways. They may bite the skin, they may burrow through the skin, or they inject the pathogen through the skin. The second mechanism to enter the skin is through damaged skin. So when the skin barrier is damaged, it becomes much easier for microorganisms to enter the body. Examples of skin damage could be wounds, burns, surgical incisions, etc. Another important route is by needle stick injuries. Needle sticks are particularly dangerous because they can directly introduce viruses into the bloodstream. Examples of viruses that can be transmitted this way include HBV, HCV, and HIV. The second way that pathogens can enter is through the GI tract. So another very common route is through the GI tract, and many pathogens enter this way when we ingest contaminated food or water. Now, the GI tract has many powerful defenses that normally prevent microbes from causing infections. And if we understand the defenses, we can understand when when pathogens take the opportunity to infect, and that is when these defenses are down. So let's have a look at the GI defenses. The GI defenses include gastric acid, which can kill many bacteria before they reach the intestine, pancreatic enzymes, bile, mucus, defensins, which are antimicrobial proteins, secreted IgA antibodies, and the normal intestinal flora, so the microbiome. And we've discussed this before. The microbiome can actually protect us from infections because the microbiome is using this environment and the nutrients and everything. So it's competing with the pathogens and it's not allowing the pathogens to kind of multiply and live because they don't have enough nutrients or a good environment or whatever. So all of these mechanisms work together to prevent microbes from surviving and colonizing the gastrointestinal tract and causing an infection. However, if these defenses are weakened or lost, infection becomes much easier. Examples of when they can be weak is, for example, low gastric acidity, reduced pancreatic functions, when we give antibiotics, because antibiotics can alter the normal intestinal flora, therefore opening the way for pathogens to infect, reduced bowel motility, which is called constipation. So, as we said, when these protective mechanisms are impaired, the pathogens have a much better chance of surviving and causing disease. So, how do they do that? What are the strategies that pathogens use to cause disease? So they've entered the GI tract. What are the strategies that they use to cause disease? There are three classical mechanisms that they use to cause disease, and those are preformed toxins, toxins in the gut, and invasive organisms. From the name, preformed toxins, we understand that the toxin was already present or preformed in the food before someone eats it. So when we say preformed toxins, the toxin is already present in the food, or present in the water, or present in whatever the person is ingesting before the person actually eats it. Examples of pathogens that do that are Staphylococcus aureus and Bacillus cereus. And Bacillus cereus is especially important in reheated rice. Now, in these cases, the bacteria don't need to invade the intestine. Instead, what happens is the bacteria grows in the food, they produce the toxins inside the food, the person eats this contaminated food, and the toxin causes the symptoms. The second mechanism we have is toxins in the gut, and this occurs when the bacteria enter the gut and produce toxins there. So they enter the gut and then they produce toxins. So in this situation, the bacteria enter the intestine, they attach to the intestinal cells, they proliferate, and then they start to release toxins. Examples of pathogens that do that are cholera and ETEC. These toxins stimulate the intestine to secrete large amounts of water and electrolytes, and this results in watery diarrhea. Now, cholera is a very important example. Why? Because it can cause death by severe dehydration, because its toxin converts the intestinal epithelium from a absorptive state to a secretory state, and this leads to massive fluid loss and electrolyte loss. Just a side note, cholera is transmitted fecal-orally, so through the fecal-oral route, which we'll discuss more when we talk about exit. Meaning the infection occurs in the contaminated food or water before the person ingests it. I want to point out just an important medication here, and that is antacids. When you give someone antacids to reduce the stomach acidity, this can actually lead to the person being more susceptible to cholera. And the reason is the stomach acid is actually very effective at killing Vibrio cholerae, which is the pathogen that causes cholera. Now, without antacids, the person would typically need to ingest about 100 million cholera organisms to cause disease. However, when you give them antacids and you reduce the stomach acidity, this can lead to about only needing 10,000 to 100,000 microorganisms to cause an infection. And just to kind of compare between pathogens, not all pathogens are of the same strength. So if we take, for example, Shigella is a extremely virulent and gastro-resistant pathogen, and so the infection can occur with fewer than 100 organisms, even if the gastric acid is normal and we didn't give the person antacids. The third mechanism is through invasive organisms. In this case, the organisms invade and damage the intestinal tissue itself. Sorry. Examples include Shigella and Salmonella. These bacteria cause damage to the intestinal mucosa, they cause inflammation, and they cause bleeding. And this results in bloody diarrhea. And bloody diarrhea is also called dysentery. Third way that they can enter is through the respiratory tract. So another major route of infection is through the respiratory tract. Like the GI tract, the respiratory tract also has multiple defense mechanisms, including microciliary clearance, immune defenses, which include defensins, secreted IgA, alveolar macrophages, and then we discussed a lot of these defenses before in other lectures, but just as a review, for ciliary clearance, the mucus traps particles and microorganisms, and then the ciliated epithelial cells kind of push that mucus upwards towards the throat, and then it gets coughed out or swallowed. For immune defenses, the macrophages are especially important in the alveoli because they phagocyte pathogens that reach the lower respiratory tract and have made it through the upper defenses. What particles usually make it to the alveoli? Particles that are smaller than 5 micrometers are able to reach the alveoli, and then obviously they're removed by macrophages or neutrophils. However, these defenses can be impaired in certain conditions like smoking, viral infections, if we have a defected mucociliary clearance, if we have impaired macrophage function. This would lead to the defenses becoming compromised, and so respiratory infection becoming more likely. The third way that pathogens can enter the body is through the urogenital tract. So this system also contains protective defense mechanisms, including bladder defenses. So frequent urination flushes out the bacteria out of the bladder. We have vaginal defenses, and those include vaginal lactobacilli bacteria, which metabolizes glycogen and produces acid, and this lowers the vaginal pH, and so it prevents fungal growth and prevents conditions like a candida infection. And we also discussed this in great detail in microbiology, so I won't go into detail about this. One idea that we should discuss is that women are more prone to UTIs. Why is that? Why are women more likely to have a UTI? This is for two main reasons. Women have a shorter urethra, and there is a closer proximity between the urethra and the anus, and this leads to obviously easier infection through the urinary tract because entry is a lot easier. Now that we've discussed all the ways that a pathogen can enter the body, the next step is dissemination, which refers to how the pathogen spreads within the body. So let's have a look at that. Once inside the body, the pathogen may either remain localized or spread and cause a systemic infection. For example, some infections that remain localized are skin infections. Many of these skin infections remain localized. However, if the infection crosses the epithelial barriers and it begins to spread throughout the rest of the body into deeper tissues and organs, this leads to a systemic spread. Now, there are many different routes and many different ways in which a pathogen can spread systemically in the body. So what are some of these routes? These routes include lymphatic spread, bloodborne spread, neural spread, and enzyme-mediated invasion. For lymphatic spread, basically, the infection goes from the lymphatic vessels to the lymph nodes, and then if it survives the lymph nodes, it goes into the bloodstream. Bloodborne spread, many microorganisms are able to spread through the bloodstream, like bacteria, fungi, protozoa, helminths. and they're transported throughout the body through the blood, and they infect multiple organs. Some pathogens can spread through neural systems, so they move along nerve fibers. Infections that do that include rabies and Varicella Zoster's virus. Lastly, we have enzyme-mediated invasion. Enzymes help the pathogen to penetrate the tissue. So these enzymes allow the bacteria to break down tissue barriers, making it easier for them to invade the surrounding structures and spread further within the body. Now that the pathogen has entered and spread throughout the body, now it's going to start to cause damage. It's going to start to cause tissue injury. So, what are some of the mechanisms or ways that pathogens cause damage? There are four ways: either through direct killing, toxins, enzymes, or immune mediated injury. And when we say direct killing, we mean that the microorganism directly destroys the cell that they infect. And they can do that in a couple ways. So there's a couple examples. We have viral cytolysis, which just means that a virus replicates inside the host cell, and then it causes the cell to rupture and die. Intracellular parasites, which damage the cells that they inhabit. We have angioinvasive fungi, and angioinvasive means that they invade blood vessel walls and they cause thrombosis, necrosis, etc., and they cause tissue damage. The second mechanism is through toxins. Microorganisms can produce two types of toxins, specifically bacteria. So bacteria can cause two types of bacterial toxins, and those are endotoxins and exotoxins. Endotoxins are part of the outer membrane of gram-negative bacteria. More specifically, they are part of the LPS, and the toxic part, the toxic component, is lipid A. So it's important to note that it's in the gram-negative outer membrane, LPS, and the toxic part is lipid A. Lipid A interacts and binds with immune receptors called CD14 and TLR4, which are located on macrophages. And when these receptors are activated, macrophages release large amounts of cytokines, and this leads to a strong inflammatory response being triggered. What are the effects of endotoxins? What do endotoxins do? Now, the effect of endotoxins depends on the dose. If you have a low dose of endotoxins, it may cause, beneficial inflammation. However, at a high dose, endotoxins can cause severe systemic effects, including septic shock, DIC, and ARDS. Now, septic shock just basically means that the endotoxins trigger massive inflammation. They cause the blood vessels to dilate, leak, and this results in poor blood flow to organs. So this will lead to three things: low blood pressure, high fever, and organ failure. So in septic shock, you have dilated and leaky blood vessels, which means poor blood flow to organs, which leads to low BP, high fever, and organ failure. DIC, which is disseminated intravascular coagulation, is inflammation that activates the coagulation system. So it leads to several events. It first causes the blood clots to form inside blood vessels. So think DIC, C clots. We're going to start by causing clots in the blood vessels. Then the platelets and clotting factors are consumed because we're using them to create clots. So because these clotting factors are used up, the patient begins to bleed. So DIC is kind of like collection of abnormal clotting and bleeding at the same time. So you have abnormal clotting and the person is bleeding at the same time. Lastly, we have acute respiratory distress syndrome. Severe inflammation damages the alveolar capillary barrier in the lung, and this leads to fluid leaking into the alveoli, which causes what we call leaky lungs. And so this leads to impaired gas exchange and severe hypoxemia, meaning the blood cannot carry enough oxygen. So in RDS, we have leaky lungs due to the damage of the alveolar capillary barrier. And so that means we have a drop in the gas exchange. And so that would lead to hypoxemia. Moving on to exotoxins. Exotoxins are secreted proteins produced by bacteria. So they are proteins that the bacteria secretes. They can be produced by both gram-positive and gram-negative bacteria. There are several types of endotoxins. A couple of them include AB toxins, such as those that are produced by diphtheria and anthrax. And in AB toxins, the B component binds, so B binds to the host cell, as we can see here, and allows the toxic active component, which is the A component, to enter into the cell. So this A component causes cellular damage, and once inside the cell, the toxin produces two factors. It produces edema factor, which leads to edema, and produces a lethal factor, which leads to cell death. Another group of toxins is neurotoxins, including toxins that are produced by tetanus and botulinum. There's also enterotoxins, such as the cholera toxin, which affects the GI tract, as we explained in heavy detail a couple minutes ago. Another important group is superantigens. Superantigens cause massive cytokine release. They cause a cytokine storm, and this leads to toxic shock syndrome, often associated with Staphylococcus aureus and Streptococcus pyogenes. These two cause toxic shock syndrome. What is toxic shock syndrome? Just a quick review of it. Toxic shock syndrome, toxins such as TSST1 trigger very strong immune activation, and this results in symptoms such as high fever, red rash, and severe shock. So if you see high fever, a rash, and severe shock, think toxic shock syndrome. Okay. What are the mechanisms in which exotoxins cause damage? They may cause enzymatic lysis of the cell. They may cause pore formation in the cell membrane, or inhibition of protein synthesis, or G protein hyperactivation, and we see this in cholera, or blocking neuromuscular transmission, which happens in tetanus and botulinum toxins. So these are some of the ways that exotoxins can cause damage. Now, the third mechanism that pathogens can use to cause damage is enzymes. Another mechanism is bacterial enzymes, sometimes called aggressants. Examples include coagulase, streptokinase, and collagenases. Now, these enzymes destroy components of the extracellular matrix, and they damage blood vessels. So as a result, blood supply to the tissues may be impaired, and this leads to ischemia. If the lack of blood supply is severe or prolonged, this can lead to what we call infraction. And infraction basically means localized tissue death, which is caused by a reduction or the blockage of blood flow. And this reduction in blood supply can be caused due to blocked arteries, embolisms, thrombi, etc. Now, the fourth and final mechanism to cause damage is immune-mediated injury. Now, in some cases, the tissue damage is not caused by the pathogen itself, but actually by our immune response. In the effort of our body, in the effort that the immune system is trying to make to defend our body, it can actually cause harm to normal bodily tissues. Examples of how it can do that: through excessive inflammation, immune complex deposition, or through a cytokine storm, so a huge release of cytokines. And we can kind of think of this injury as collateral damage, meaning the immune system damages host cells while it's trying to fight off an infection. Now that we've discussed mainly how bacteria cause damage, let's have a look at viruses. Viruses have their own way of causing damage. Viruses can cause diseases through a couple mechanisms, and those include the first one that we're going to discuss, which is receptor binding determines tropism. Tropism is basically refers to the specificity of a virus for certain cells or tissues. So viruses connect or bind to a particular receptor on host cells. So it just shows that viruses infect cells that have, specific receptors that they can bind to. For example, in HIV uses its GP120 protein to bind to the CD4 T cell receptors CCR5 and CXCR4. And this is why we typically see that HIV specifically targets the CD4 T lymphocytes because of the specificity of the receptor binding. The second way that they can cause disease is through direct cytopathic effects. So viruses may cause direct damage to the infected cells, known as cytopathic effects. And this damage can occur through toxic viral proteins, through the induction of apoptosis, which is programmed cell death. And these two processes would obviously lead to either cell injury or cell death, contributing to tissue damage. Third mechanism is through cell fusion. Now, some viruses cause infected cells to fuse with neighboring cells, and this creates large multinucleated giant cells known as syncytia or polykaryons. And this occurs because viral fusion proteins promote the merging of the cell membranes, and we see this in infections such as measles and herpes, which we discussed the 3 M's a couple minutes ago, and we said that it causes membrane fusion. That is herpes virus. Lastly, we have transformation. So some viruses can alter normal cell growth control, leading to cell transformation and cancer. Examples of viruses that do that: HPV, EBV, HBV, and HCV. And these viruses interfere with the normal cell regulation, and this can promote oncogenesis, which is, cancer, development of cancer. Now, we've discussed, how they cause damage. We've discussed how our immune system can respond to these infections. And we know that the immune system is a huge obstacle for microbes, because if a pathogen wants to, cause disease, it must evade the host immune system. So how do they do that? How do microbes evade the immune system? They came up with a couple strategies, which include antigenic variation, intracellular hiding, resistance to antimicrobial peptides, resistance to phagocyte killing, downregulation of T cell responses, and resistance to phagocytosis. So let's have a look at the first process, which is antigenic variation or disguising antigens. So in this process, microbes change their structure of their surface antigens. So old antibodies that the immune system recognized and could, bind to and read before is no longer helpful, because the microbe changed its surface antigen. So, as a result, the pathogen is able to escape immune detection, even though the immune system has already produced antibodies against them, but they produced antibodies against the earlier form. So basically, the virus had a earlier form with a specific antigen. The immune system recognized that, created antibodies for it, and then the virus went ahead and changed its surface antigens. So now the antibodies that are created by the immune system cannot fight it because they don't recognize these new antigens. The second way is through overcoming antibodies and complements. So this just basically means that a pathogen is hiding inside the host cell. So the antibodies and the complement system mainly work outside the cell. So if antibodies and complement system is working outside the cell, if the antigen hides inside the cell, it can escape the immune system. The third way is through resistance to antimicrobial peptides. So the body produces antimicrobial peptides or proteins, and these are components of the innate immune system. Now, these peptides normally damage or destroy microbial membrane, and then they eliminate the invading microorganisms. However, microbes may develop resistance to these peptides by several mechanisms. Including altering their membrane surface, so antimicrobial peptides cannot bind effectively, producing proteases, so enzymes that break down and degrade these peptides, and using transport pumps, so they export the antimicrobial peptides out of the microbial cell, and so then they can't kill it. Fourth way to escape the immune system is through resistance to phagocytosis. So a defense mechanism that we have is phagocytosis, where immune cells like macrophages and neutrophils engulf and destroy a microbe. Some microorganisms can avoid being engulfed by modifying their surface structures. And these surface structure modification prevent recognition or attachment by the phagocyte. So the phagocyte cannot attach or engulf this microbe because it doesn't recognize and it has no way to attach to its surface, so it cannot eat it up. The fifth way is by downregulation of T cell responses. So some pathogens suppress the adaptive immune system, especially the T cell response. One mechanism involves the activation of the immune inhibitory pathway. So we activate the inhibitory pathway that inhibits the adaptive immune system. An example of this pathway is the PD-1 and PD-L1 pathway. So when this pathway gets activated, the T cell activity is suppressed, obviously, because this is an inhibitory pathway. This allows the infected cells to escape immune attack. Interestingly, some just new research, modern cancer immunotherapies actually target this pathway. When they block the PDP or PD-L1, so they inhibit the inhibitory pathway, they block the inhibitory pathway, these treatments will restore the T cell activity and they help the immune system attack cancer cells. This is just a small side note. The last way is through resistance to phagocyte killing. Even if the microorganism is successfully phagocytosed, so it was engulfed, it was eaten up, it can still survive. Why? Because certain pathogens can interfere with the intracellular killing mechanisms of a phagocyte. Because once the phagocyte engulfs a pathogen, it still needs to kill it inside it. So it uses mechanisms to kill it inside it after it's engulfed it. So if we block these mechanisms, the pathogen can survive. What are some of the ways that it can block the killing mechanism? By blocking the fusion of the lysosome with the phagosome. preventing the formation of the phagolysosome. And a classic example of a bacteria that does this is Mycobacterium tuberculosis. Another way is by degrading the phagosome membrane, which allows the microbe to escape into the cytoplasm. The third way is by escaping from the phagosome before destruction occurs. So using these couple of mechanisms, the pathogen can escape the immune system. We can actually summarize and remember these escape mechanisms by the mnemonic HIDE. H for hide in cells, I for inhibit phagolysosome formation, D for disguise antigens, and E for evade the T cell response. Now that we've talked about how these microbes cause damage, the last step is to exit the host. So for an infection to spread to another host, it must exit. So how do they exit? Pathogens can exit through a couple routes, including genitalial secretions or skin lesions, and these usually lead to STDs, by oral secretions through saliva or oral secretions. Examples of diseases that are, kind of spread this way are mumps virus, HSV, CMV, and rabies virus, EBV, and HPV. Third way is through respiratory route, so through droplets. Examples of that is influenza and Mycobacterium tuberculosis. They spread by airborne droplets. Then you have through the urinary tract, so they're shed in the urine and they contaminate fluid. Through the fecal-oral route, so it exits through the stool and then it contaminates food, water, whatever, and then it's ingested. This route is called fecal-oral transmission. We have blood-borne transmission, so some organisms may spread through blood exposure. This can happen because of vectors, because of blood transfusions, because of needle stick injuries. Examples of diseases that can happen because of this is HBV, HCV, and HIV, which we discussed earlier when we talked about needle sticks. Lastly, we have vertical transmission, which just means transmission from mother to child, and this transmission can occur either through the placenta during pregnancy or during childbirth or through breast milk. Now, why is it important to understand, exit mechanisms? Why do we need to know how pathogens exit? Because we need to have an understanding of how a pathogen enters and exits a host so that we can implement public health measures to avoid or control this infection. And some of these methods include, masks, hand hygiene, vaccinations, isolation, safe intercourse. How can we decide which of these need to be used for what, pathogen or disease if we don't understand how this disease enters and exits the host? Now that we've talked about microbial pathogenesis and how pathogens can enter the body, cause disease, how do they leave? This brings us to the point of tissue response. How does our body, our tissues respond to these infections? What does our body do? There are a couple ways or mechanisms in which we respond, including supraactive response, granulomatous response, necrotizing, chronic, and viral cytopathic responses. Let's start with the first one, which is the supraactive purulent and inflammatory response. This response is categorized by large numbers of neutrophils and pus formation, and this pattern often leads to abscess formation. And an abscess is basically just a localized collection of neutrophils and liquefactive necrosis. This pattern is typically caused by pyogenic bacteria, which are bacteria that produce pus. And common examples of, bacteria that cause this response in our tissue are Staphylococcus aureus, Streptococcus pyogenes, and gram-negative rods. Now, as we said, remember when we talked about the diagnostic tools and I talked about the histopathology, and I said that we can kind of narrow down what disease caused what by looking at the tissue response. This is what I mean. So when we know that certain bacteria or certain viruses or certain disease pathogens cause certain response from our tissues, we can narrow down what antigen caused this disease. So in this case, for superactive, it's Staphylococcus aureus, Streptococcus pyogenes, and gram-negative rods. Now, just a clinical, note, something that can help you if you're answering questions. If you see a large number of neutrophils, so we have an increase in neutrophils, this strongly suggests a bacterial infection, because neutrophils are kind of like your main fighter against bacterial infections. The second response that we're going to look at is the granulomatous response. So in this response, we have obviously the formation of a granuloma, and a granuloma is a structured collection of immune cells formed to contain organisms that are difficult to eliminate. So we create a granuloma to contain an organism. Granulomas are composed of activated macrophages, epithelioid macrophages, lymphocytes, and multinucleated giant cells. And examples of diseases that we see granulomas in are tuberculosis, fungal infections, and certain parasites actually lead to the formation of granulomas. Okay, moving on. When I talk about granulomas, it's important to talk about the two different types of granulomas that we can see, and those are the cascading granuloma and the non-cascading granuloma. And the main difference is basically in the cascading granuloma, it contains a certain central necrosis, which appears cheesy on gross examination, and we typically see this in TB. And then you have the non-cascading, which lacks this central necrosis. Another kind of important an important rule that can help you in solving questions: if you see a granuloma and eosinophils, this highly suggests a parasitic infection. It highly suggests that there are parasites involved. The third pattern is a necrotizing pattern, and in this pattern, we see cell death or necrosis. Sometimes infraction may also occur, and we discussed infraction in detail a couple minutes ago as well. Possible causes for this are microbial toxins, ageno-invasive pathogens, or severe ischemia. Fourth way is through a chronic inflammation. So some infections produce chronic inflammation, and this pattern is categorized by mononuclear inflammatory cells, mainly macrophages and lymphocytes. We also see fibrosis, which results in tissue scarring, and this pattern of chronic inflammation is usually seen in obviously persistent or long-standing infections. Fifth way and last way is viral cytopathic pattern, and we spoke a little bit about this when we talked about the herpes 3Ms, and I said we'd discuss it in more detail at the end of this video, and here we are. Viral infections often produce specific cytopathic changes in infected cells. So when we look at the cell under the microscope and we see certain structural changes, we can know which virus produced these changes. Typical features include inclusion bodies, multinucleated giant cells, and sparse inflammation. A key feature of viral infections is that you will see prominent cell injury, but you will see less inflammatory infiltration compared to bacterial infections. So in bacterial infections, you see a lot of inflammation. In viral infections, we see less of inflammation and more prominent cell injury. Let's have a look at inclusion bodies and what they are. Inclusion bodies are aggregates of viral proteins inside infected cells. So they are a group of viral proteins inside infected cells. And we can find these abnormal proteins clustered either in the nucleus, in the cytoplasm, or both. Inclusion bodies are often important in acting as diagnostic clues for identifying specific viral infections. Again, from the type of inclusion, we can narrow down what virus caused this infection. So let's have a look at some of the examples of inclusion bodies. Some examples of inclusion bodies include CMV, HSV, and rabies. Let's have a closer look at each of them, starting with CMV. CMV inclusions produce a characteristic owl's eye intranuclear inclusion. So the inclusion is found in the nucleus. Features include a large basophilic, so appears blue or purple, intranuclear inclusion, surrounded by a clear halo. And the infected cells become very large, which hence the name cytomegalovirus causes the cells to become very large, and we find large basophilic intracellular inclusion surrounded by a clear halo. Second example is HSV, herpes simplex virus, produces a cow-dry type A intracellular inclusion. So again, in this case, we find the inclusion in the nucleus, intranuclear inclusion. But in this case, it is eosinophilic, so it appears red or pink, as we can see in the slide at the right. HSV also shows the classic microscopic features that we discussed before, which are the 3 M's: multinucleation, migration of the chromatin, and nuclear molding. Lastly, we have rabies virus. Rabies infection produces Negri bodies, and these are eosinophilic cytoplasmic inclusions that are found within neurons. So these inclusions are found in the cytoplasm. If we remember, the last 2 were in the nucleus. This one, however, is in the cytoplasm, and it is found within neurons or within neural cells. Now, a nice way to remember that rabies virus produces Negri bodies is that when you see a wild dog, you always think rabies first and you run away. And run away in an Arabic Egyptian dialect is Negri. So you're gonna run away, Negri, hanigri, min the dog, which causes rabies. So rabies virus causes Negri bodies. Okay, with that being said, we've looked at all of the examples of inclusion bodies. I want to talk about one more virus, which is HPV. HPV produces a classic characteristic cell. So in HPV, we see a classic cell characteristic that we call coleocyte. Now, what are the features of a coleocyte? It has a prenuclear halo, which is a clear space surrounding the nucleus, and a condensed and irregular nucleus. These are not true inclusion bodies. They are visible viral protein sorry, they are not true inclusion bodies because there is no visible viral protein aggregate. Instead, this is just structural cytopathic change in the infected cell. So HPV causes a structural change in the infected cell, and we call this structural change coleocyte, and the features of coleocytes is a prenuclear halo and a condensed irregular nucleus. Lastly, some viruses cause cell fusion, where infected cells merge with neighboring cells, and this produces large multinucleated giant cells, and we call these large multinucleated giant cells syncytia or polykaryons. And examples of viruses that do that is measles and HIV. And in measles, we see a classic histological finding, and that is the presence of Warthin Fincadeli giant cells. With this, we conclude today's video. Thank you for listening, and I hope this video was helpful. Thank you.